Senator Colbeck.
Thank you, Mr. President. I rise to give my no vote explanation as well. My colleagues, this bill essentially extends limited arrest powers to agents of the Department of Health and Human Services. And just for those of you who aren't aware of this, that's a primary execution arm for health policy in particular in the state. A lot of times when we pass legislation in regards to what that policy should be and what those rules should be, they're pretty much just continuance of what's being done up at the federal government level. And in particular, I've been warning my colleagues quite a bit about something called the Affordable Care Act. Most people refer to it as Obamacare. And I have always admonished my colleagues that implementation of different aspects of this act were more about control than they were about care. And this is when you start talking about providing these limited arrest powers to agents responsible for enforcing rules and regulations that are being promulgated under the Department of Health and Human Services, you start getting into that camel's nose under the tent that gets more and more credence to that concern around the federal government's overreach into policies that should not, or into areas that they should have no authority on, and it really emphasized that control, not care concern that I've addressed before. So I am very concerned about this legislation, and I'm hoping that the folks over in the House may put a stop to this as we go forward. So thank you very much, Mr. President. I'd like my remarks added to the Journal.
Thank you, Senator Colbeck. Those remarks will be put into the Journal as your no vote explanation.